afternoon, ma'am. My name is Christine Miragay, and now I'll be going to do the admission of patients. So the first step we need to do is to prepare patient's unit as soon as notified by admitting clerk. Then we need to check bed for cleanliness, check closets and toilets, and then we will be going to assemble our equipment and take to units. So we have here the face towel, the hand towel, and the bath towel. We also have the patient's gown or pajamas, the bath soap, the stethoscope, the thermometer, and then the toilet paper. This is the drinking glass of the patient, the fork, spoon, and the teaspoon. So we also have here the pitcher with water. So here below is the urinal or the bed pan. So we need to make sure that there is a lining. So since we don't have a sphygmomanometer and a kidney basin, then we just need to use the this equipment we have for now. And then we also need to include the kidney basin and the sphygmomanometer. So that's all our equipment that we'll be using now. So the next step we need to do is to prepare bed of the patient. So we need to make sure that before the patient will take in the room, the bed is already prepared. So next is to greet our patient and to introduce ourselves. So good afternoon, sir. My name is Christine and I will be your nursing assistant today. So may I know your name?
My name is Marlon.
Thank you. And how about you?
My name is Matt.
Alright, thank you so much. So, are you my patient today?
Yes.
Okay. So let me take you to your room. Alright. So the next step we need to do is to provide privacy of our patient. So we need to assist patient in changing to hospital attire, and then we need to screen if necessary. So let's change your attire first. Alright, so after the patient already changed his attire, then we need to assist the patient to bed. Please lay down. So the next step we need to do, since we have already assisted our patient to bed, is to take vital signs. So we need to use the thermometer in getting the temperature of our patient. Then of course the stethoscope and the sphygmomanometer in getting the blood pressure of the patient. So after that is to orient patient with, to unit and personnel. So sir, since you are the father of my patient, I just want to remind you that we have already provided you a telephone. So in case you need something from us, you can always call us directly using the telephone. And of course for the visiting hours, my patient can only have visitors during 7 a.m. until 11 a.m. in the morning, and then 2 p.m. until 6 p.m. in the evening. And for the meal time, there is no need to worry since we will be providing you or serving you a meal. So in the morning, we will going to provide the meal or the breakfast of my patient around 6 a.m. And for the lunchtime, we will be going to provide him his meal around 11 a.m. also, and for his dinner, it will be served around 6 p.m. So for the bathroom facilities, we have here the bathroom already. So the things you need to, there is already complete. So you can use it anytime or every time you need to go to the bathroom. So now for the use of electrical appliances, so for the turning on and off of the lights, you can use it, or you can turn off and turn on the lights whenever you need to or you want to. And then if you want to add another electric fan, that would be fine. However, we will be going to charge you for that after we have checked your bills already. And lastly, for the bringing of food from home, that's actually fine and there would be no problem for that. But as long as every time your friends or your families will bring food from the patient, we need to make sure that it is healthy and good for the patient. Alright, that's great. So now the next step we need to do is to attend to patient's belongings, and lastly is to leave the patient comfortable with bed cold within reach, and then lastly is to do aftercare of the equipment and wash hands. So now that would be all, and thank you so much for watching.